Thank you for joining us on this program. It is going to be, I hope, really worthwhile for you because you need to know about lifting PDO threads. You cannot get total facial aesthetics without lifting PDO threads. You're going to hear me say that a few times because it's the only thing that can lift sagging skin. So you're going to learn a lot more about it in the coming next few minutes here for sure. So make sure you really enjoy this, understand this, and understand how it can literally change your patients' lives and they can get the kind of aesthetics that they really want here. So you're going to see that soon. My name is Dr. Louis Maltzmacher, and I am president of the American Academy of Facial Aesthetics. It's so great to be with all of you. If you have any questions after this, feel free to reach out to me at drlewis@facialaesthetics.org or the AFE at infofacialaesthetics.org, the American Academy of Facial Aesthetics. It is the #1 CME certification live patient training organization for injectables for dentists, physicians, nurses, nurse practitioners, and physician assistants and anyone else that can do this, because there are states that do allow other professionals to go ahead and do this. But this is a great resource slide for you. afetraining.com. That's where the AFE shows all of its great tuition specials, and so check that and make sure you really get the best tuition deal possible. They do their best to really make it get so much value and such great training at the most reasonable price. So, but you also get membership. It's also about you being successful here. avvirtual.com is going to be the only live virtual CME certification training on smooth PDO threads. You'll learn more about that a little bit later. AV Cadaver Lab is great. There's nothing like a cadaver lab. We're going to show you a clip from the AV Cadaver Lab, so make sure there's no one else with you around you that doesn't like cadaver dissections, because you're going to see one specifically as it relates to smooth and lifting PDO threads here as well. But come to an AV Cadaver Lab. They are amazing and certainly the most reasonable tuition that's out there. Always check avwebinars.com because that's where we post trainings all the time, whether they're free or whether they've got tuition, online trainings here about topics across the spectrum when it comes to injectables. StatDDS.com, that is the supplier of all things by Comfortox, which is syringes and microcannulas and BLT and so much more. And they've got lots of other things for you as well. vsoftlift.us, that's going to be the PDO thread that we prefer, and you will see why and how it's different than any other brand that's out there. But we will review the other brands and show you what they show on social media and on their trainings there as well. Then Wave Aesthetics is the best optimized for facial aesthetics ultrasound at the most reasonable price. To check all those things out, this is a good slide to take a picture of because you will want to refer back to some of these as well here. Please follow the AFE on Instagram, Facebook, YouTube, and TikTok because we're very, very social and we're on these platforms all the time here. Live patient CME certification training. That's what the AFE is really all about here. And that is something that you all need. So we welcome you to all of that. AFEtraining.com gets you to all of that, whether it's level 1 Botox and fillers, level 2 advanced, level 3 master courses of Botox and fillers, and then master's eyes, lips, nose, lifting PDO threads, live patient training. That's really what you need for it, as you'll see. For that, that's the only way to really learn it. Solid filler PDO threads, so much we've got for you. So it's great to have all of you here. Get going. It's all about anatomy, safety, and technique when it comes to the AAFE for sure. And what do we love about injectables? It is a dream practice because whether you're a dentist, physician, nurse practitioner, or PA, starting a practice, have a practice. It's a recurring revenue center. These patients are going to keep coming back to you because Botox only lasts 3 months, fillers last 6 months, PDO threads actually last a lot longer than that, a year to 2 years, as you're going to see. It's the happiest part of your practice. People are happy, they're healthy, they pay. There's none of this insurance nonsense. Your only investment is yourself. There's no capital investment. It's in your skill, and it's really it's just amazing what you can do with all of this. And you know, masks have really accelerated all of this. It's been incredible. It's accelerated aging by like 5 times. And ask your family and friends and AV members. You take a look at your numbers. AV members in 2022 were up 30 to 48% in injectables. Is the rest of your practice been like that? No. So if you've been thinking about that, and for most of you, you've been doing Botox and fillers already, you must add this to your practice. You cannot do what we call total facial aesthetics without Botox fillers and PDO threads, as you are going to go ahead and see. And let's see, how important is the lower face? How old do you think this patient is? So whatever, however you're watching this, if you think about it in your head, write it down. What do you think? And this is so common, by the way, with all that time in masks. People were getting their treated, and they only cared about the aesthetics of their upper face here. But how old do you think this patient is? And some of you guess 30, 40, 50, 60, and you figure it's a trick question. So 80, 90, it could be any of those things. But she easily could go for late 30s, early 40s if you want to put her at 50 or whatever else like that. But now take a look at her, take the mask away. And how old do you think she looks now? The lower face makes all the difference in the world. And how do you fix that jowling? How do you fix that collapse of the lower face? So people have said, well, you can't do it really with Botox because Botox affects muscles. Fillers lift. No, they don't. Fillers are a jelly material. How much lift do you think you're going to get out of a jelly material? Nothing. You get, there's studies that talk about how much lift you get out of it. 1 millimeter, you tell me that's clinically significant on a patient like this? Not even close. So let's take a look. What does each injectable do here? So solid filler PDO threads, there are 2 kinds. There's smooth and there's lifting. We're going to show you both here, and we're going to talk about all the different brands and why AFI Techniques and the brand that we use, VSoft Lift, is really so much different than anything else out there. And you decide. I'm going to show you everything that some of the different brands show you, and you decide for it. But what do solid filler PDO threads do? They will, lifting PDO threads will lift sagging skin. It's a physical lift. You'll see the anatomy part of it in just a little bit, but also as PDO threads break down, they produce collagen, the body, and you'll see that in just a little bit. So that's what solid filler PDO threads do. They're a collagen biostimulator, and the lifting PDO threads will physically lift sagging skin. That is what they do for that. Now, botulinum toxin or Botox, Xeomin, those kinds of things relax muscles, gets rid of dynamic wrinkles, takes care of oral facial pain that comes from muscles, which is 85% of the time. Fillers add volume and hydrate. You've got to use them all together. You'll actually see some of this patient's treatment here in just a little bit for all of this. So VSoft Lift. We're going to talk about VSoft Lift, but we're going to talk about the other brands there as well, so you can really compare them for all of this. But these are what lifting PDO threads look like. This patient actually, the only treatment she had so far in this before and after was lifting PDO threads. She came in for that first, before Botox, before fillers. She hated those jowls. She says, I want to fix that first. She didn't know anything about any of the injectables, and that's what she started. So that's purely lifting PDO threads. You see what kind of a result you can get. She will take far less fillers than if you hadn't done lifting PDO threads. Botox will probably be pretty much the same for all of that. But what do PDO threads do? What's PDO mean? PDO really stands for polydioxanone. Polydioxanone has been a suture material in medicine, in dentistry, in nursing for decades, close to 50 years. It is a very, very slowly absorbable suture material, but when you use it for aesthetics, patients go ahead, and the body's natural reaction as it slowly breaks down over 4 to 6 to 8 weeks is the body, when placed in the subdermal plane right underneath the dermis, the body produces collagen, and that is amazing for that. Again, that smooth PDO threads specifically, lifting PDO threads do that too. In addition, lifting will give you a physical lift here, but that production of collagen gives you that skin the foundation. Neocollagenesis is the process surrounding tissue adhesion. It gets rid of cellulite, acne scars, but it rejuvenates the skin. It literally regenerates the skin and the vasculature, and that's an amazing thing. And you can see from this micrograph, those big, hunks of material on the bottom of that slide are PDO threads, a cross section. All above it, beautiful. Type 1, type 3 collagen elastin production. Other things don't do elastin. Sculpture, if you're familiar with that, does not produce elastin, but these do. These are among the best collagen biostimulators and the easiest to apply. And how long do they last? They last a long time. There are lots of studies of this already here, and they can last 12, 18, 48 weeks. They can last longer than that in terms of the collagen production, and the tissue changes over time. It keeps producing collagen in some patients even longer than that. It does amazing things for patients. You can't get that from Botox. You're not going to get that from fillers. And where are we going to go? We're going to go for lifting PDO threads, and I'm going to show you an anatomy dissection here in just a minute. But for lifting PDO threads, we are going to go to the SMAS layer. That SMAS layer, if you're not familiar with it, you're going to see it soon. But it's skin, it's dermis, it's epidermis, dermis, subcutaneous fat, and then you're going to have what's called the SMAS layer, which is a fibrous tissue that covers the muscle. That is the same layer that's the layer we hook onto for lifting PDO threads. It's the same layer when plastic surgeons, and I know we have a number of plastic surgeons that are on this as well who are looking to learn about this, that if they do something called a mini facelift, that's the layer, the subcutaneous, the SMAS layer, I'm sorry, is what they grab to pull it up and back and tight. That is typically called in the industry a mini facelift for that. So that's what we're looking for right above the muscle, and that's where we're going to use PDO threads. And there are a ton of plastic surgeons that used PDO threads. We've trained a lot in the AAFE for that. But you know what? I could talk about this slide all day. Let's go ahead and show you. But warning, get other people out of the room if they don't like cadaver dissections. Let me show you a cadaver dissection from an AAFE cadaver lab, which we have around the country many times, and you're welcome to come to one. And these are the things we do. We let you go ahead and try these. We inject and dissect. That's what we do. You go ahead and inject, and then you cut them down, and you see exactly the layers, no matter if it's fillers or PDO threads. So here we go. Let me just get this out of the way. All right, here we go. All right, we want to just show you the power of these PDO threads here, and this is the Vsoft Lift brand that we use here. So go to the top where we placed it, Dr. Kimball here, and just give it a little bit of a tug, and you can see what that tug looks like, nice and strong. But now let's go down to our dissected part, and let's see the end of a thread. This is a very, very unique view that you can go ahead and see. Take a look. All these threads are doubled over, trying to get that view so you can see that doubled over part of the thread here, and we see it right there as it comes out of its cannula and it goes around, and you can see how that's doubled over. And that's what's attaching. Part of it what's attaching is all those barbs on the side, but this also, when we dissected it out really pretty nicely, you can go ahead and see this is all what's attaching to the skin for that. But let's take a look at this cross section. Take us through this cross section here, Dr. Kimball. Now, some of the stains you're seeing is from filler that was injected as we're doing different things in the AAFE cadaver lab and some testing and experimenting today. But take a look at this thread and take us through the different layers here and what we're taking a look at.
So this thread is in the correct plane. So we are in the fat of this area. So we have our skin and our dermis, and this is our superficial fat pad. It's real globular. And then below that is where all of our muscles are and all of our vasculature. So we're in a very safe plane. Our vessels are below it, our muscles are below it, and this is just the fat. That's that butter that you get into in cannula flows through it real easily till you get down into this region.
But
So
all the barbs on these threads are really attaching to which
Right.
plane?
they're attaching into the fibrous part of this superficial fat. So they're caught in the fibers of the superficial fat. That's what's maintaining that lift there.
Right, and you can see it. And it's something that we refer to a lot as the subdermal plane and the SMAS. And this is
Right.
exactly the area of that we're looking at in terms of that SMAS. And you can literally see the outline. Just hold that back a little bit. You see where that thread is right there. It's literally in that defining area between the, in that subdermal plane and right at the SMAS, right above the thread. So that is really placed in a perfect plane, and that's what you're looking for, and that's what you're trying to get to and achieve to really get the best lift. And you also have to use the strongest threads for sure, but that is where you've got to get to. So that's a really unique view for you to be able to really go ahead and see that. But here are the important things, though. Now let's start talking about PDO threads themselves. And the first thing you need to know is that not all PDO threads are the same. Just because you say PDO threads, people assume, oh, it doesn't matter where I get them from. They are all the same. They are not. Some are much stronger. Some are much weaker. And again, I'm going to show you everything from some other companies so you can decide for yourselves. And certainly many of you have been trained on PDO threads in the past. You're so frustrated. The training may or may not have been very good, but even if the training was good, the PDO thread was so horrible, and you had to put in so many PDO threads for one side of the face, like this one that's got about 20 PDO threads on one side of the face. Not AFE, not V-soft lift, and we'll get to the differences there. But you need to ask manufacturers and trainers for those manufacturers, because really the AFE is one of the very few independent CME live patient certification courses not backed by a manufacturer. We certainly use the best product available, but if it's from a manufacturer, manufacturers want to teach you as many threads as possible, because that's what they want to do. They want to sell threads. What do I want as a clinician for my patients? The maximum effect with a minimum amount of product or threads or Botox or fillers or anything else. That is the philosophy that you all have as healthcare professionals here. So ask them, how many threads is it going to take? Who really manufactures the threads? Because as you're going to see in a moment, we're going to get to the FDA clearance on these threads. Does the patient need to be sedated for a procedure? This kind of procedure that you see right here on this slide, again, it's not AFE, it's not V-soft lift. Those patients typically need a full face of anesthesia. They need, and again, it's not me saying this, it's their trainers that say this all the time. I've been on many of their webinars and trainings and conferences for that. They automatically give a patient, after these kinds of things, putting 20, 40, 50 threads in someone's face, lifting threads. That is a very, very invasive procedure. They automatically put them on antibiotics, steroids, and narcotics after the procedure. Some of you know this because you've been trained and you've tried some of these cases, and the effect is good, but is it worth the procedure? Why not fewer threads, better technique, and you'll get a much better thing. And the other thing that is just, and again, it's not me. I mean, these companies do this all the time. They keep, every year, they got to sell more threads, and they keep putting on new threads. But I don't understand, manufacturer. Last year you told me that the thread you put out last year was the best and better than the one you put out than the year before. And it keeps going on and on and on and on for that. They keep going, and they just launched, one of the companies just launched what they called the Beyond thread. I think this was Nova Threads, and in their introductory lecture about it, well, yeah, you put a bunch of Infinity on tops of Barb 5s and then Beyonds on top of it. You're laying all these threads. How many threads are you putting in already on the patient for this? And then you've got the companies that have easy threads, and what's funny about one of the companies that says they're an easy thread is that when you're on their own website, they talk about the ease of use for their easy thread. It's a 1 out of 5. Well, something's wrong with that picture there. And then any company that needs a fix or a fixation thread on top of their other threads, basically, what does this tell you? If you need this many threads, and again, I didn't do this case, and they showed this case proudly on social media and on online trainings all the time. If you need this many threads, what does it tell you? The PDO thread cannot be that strong. And there is the big frustration for many clinicians. This takes a very special patient to be very tolerant of a huge procedure, and I would bet most of you couldn't sit through this. So these are the things that you really need to know. Another thing, and because this is such a huge problem right now, especially in the US here, another thing is, this is not how you want your PDO threads made. They should not be touched by human hands. And this is a huge problem, again, because there are 3 or 4 manufacturers globally that are all automated, that put out the best PDO threads. And then there's lots of other manufacturers that are just doing it by hand. And I can tell you, just by consulting and being in biomaterials manufacturing, that is not what a sterile room looks like. So God only knows. The problem for you as the provider, you have no idea what is happening and where you're getting this thread from or how it's made, unless you really have in the US an FDA clearance class 2, and you have proper packaging and you have known origin. And the problem is that many of these companies are hiding behind things, and you're never going to know. So this is how we look at it. This is our opinion. You can take it or leave it. But I can tell you from working for years with medical, dental, and nursing boards, and the AFE consults with them regularly on all kinds of issues, that if you ever have a patient complaint and you are brought before a licensing board, they're going to ask you a few questions. First of all, what's your training like? Oh, I learned it from Sally on Instagram. They will laugh at you, okay? And you're pretty much, your case is dead in the water before you even get started. And then, what did you use? Okay, well, is it a FDA cleared class 2? The FDA has proper packaging requirements? Known origin. Now, we've done a lot of research on known origin. We've gone to the companies and asked them straight out, where they're manufactured, show us who the manufacturer are. Again, there are only 3 or 4 reputable international automated manufacturers of PDO threads. The rest I wouldn't touch with a 10-foot pole, and you're probably putting your patients at risk. My opinion for all of that. Most of the companies, well, let me put it, most. 3 or 4 companies will fit that first requirement: FDA cleared class 2, known origin, proper packaging. That's going to be VSoft Lift, which also was the first FDA cleared, not only the PDO thread, but in cannula together. So that combination, that's VSoft Lift, Nova Threads, and Mint PDO. Now, why we use VSoft Lift, you'll see that soon. Part of the answer was in that past slide with all those threads hanging out of that patient's face. Now, other companies, and again, we've reached out to them, and you're feel free to reach out to them too. They will not tell you the origin, which means anything could be going into that package, even though they have an FDA cleared class 2 product, they claim, but you have no idea because they don't tell you who manufactures. One company says we're the manufacturer, and they're not the manufacturer because their packaging says manufactured for. Okay, so clearly they're not that, or improper packaging. If you look at on the right side of your screen, if your packaging looks like that and got a little sticker on it and the rest of the thing is blank, you should not touch those PDO threads. Our opinion. It's your license at risk, not ours. But and that's it. So FDA listed, so we only use the top line. FDA listed class 1, that means nothing. All that means is the company paid a fee. This is an FDA cleared class 2 category PDO threads, not a class 1. So, and then these companies will out and out just lie to you. And then the last line, not listed on the FDA website at all, not advised at all. You can see my exclamation points get bigger and bigger. They'll say, well, it's made by an FDA cleared thing. Great, but your name needs to be on there too. If I can't find your name on the FDA website, then there is something that we wouldn't use in the AFE, and most AFE members would not use either because it's your license at risk. And there are lots of names. That's the funny thing. There are about 20, 25 companies in the U.S., and only a very few are even on the FDA website. When you do a search for medical devices. So it's something that you're responsible for. And I just put a couple of instances. We're involved with boards all the time. An MD and NP fine, $135,000, 1 year suspension of license, a DDS fine with a suspension there as well for using non-FDA cleared or approved products like, like when you buy Botox from a Canadian or Mexican manufacturer or from overseas or all the other garbage that you see for that. So this, and if you have any information, I'm happy to update this slide, but you don't have to do it. I just did it literally just today to go through this again. You try to find some of these names on the FDA website for that, but I'm using one of the top lines if I'm using anything at all. And why vSoft Lift? Well, you're going to go ahead and see for yourself. The reason being vSoft Lift is because they are by far the strongest thread that is out there. And this is a strength equivalency chart or a collagen biostimulation chart for that. For every one vSoft Lift, you need 3 to 4 Nova threads, 4 to 5 Mint PDOs. And again, it's not me. Compare the cases as we are going to show you in just a minute. Let's take a look at a case and you'll see, well, we can do in just 3 or 4 threads, they're going to take 3 to 4 times more or 4 to 5 times more. Again, you're the provider if you like doing those cases, but I can tell you, we hear from people all the time that are so frustrated for that. And we'll just I'm having trouble with my mouse here. What is happening here? All right, here we go. For this. All right, so let me talk about lifting threads here just a little bit, and that is going to be, there are 2 kinds of lifting threads. We'll show you a quick case of smooth PDO threads later on for collagen biostimulation, but for lifting PDO threads, let's show you a couple of things here. There are 2 kinds. There's barbed and there are molded, pretty much. So again, these are the vSoft Lift. The top one is a barbed star, it's called, and you can see what it looks like, and those are laser cut barbs and those kind of prongs that come up. That's what attaches to that SMAS layer. Then there are molded threads. Now, the vSoft Lift line, the Barb Star, are approximately, in our testing and others as well, 20% stronger than all the other ones that are out there. Again, that pretty much relates to why you need more PDO threads with some of the others out there. The molded threads are even stronger than that, and they come in different sizes and different shapes and different thread designs for that, depending on, do you have, you have thin, do you have medium, do you have heavy tissue? Heavy tissue, you're going to want that anchor thread on the bottom there, which is a 17 gauge, which is one of the thickest ones that are out there. Thick is not always good, but it is good in certain cases here. They do not have vSoft Lift a new thread every year, just like Botox doesn't put out new Botox every year, because when you have the strongest thread with the best collagen biostimulation, that's FDA cleared class 2, known origin and proper packaging, there's no reason to put out a new thread. Okay, this works better than anything else that is out there too. So they have a range. You don't need a big range to really go ahead and get this done here. And again, I love this. This is great. I mean, look at the tray setup on the left, which is not vSoft Lift. Look at the tray setup on the right, which is vSoft Lift, with a very comparable case between the two. And again, these people post this all the time on this as well. And for the love of God here, let me just get this going. For the love of God, don't use bare hands when you're grabbing a whole bunch of smooth PDO threads. And again, let's look at that tray. This is not the AFE, this is not vSoft Lift, but please use gloves. And another major mistake that they've done here is your PDO thread should stay in its original packaging, which are airtight sealed packages. Take out what you need, then put it back in there. Never ever dump your PDO threads into a big plastic bag and then do that. Why? Because air leaks through those plastic bags a lot worse, and air will degrade the PDO threads when you store them like this. Maybe that's why they need, this person needs so many threads. But if you're putting in, by the way, these are smooth PDO threads. If you're putting in, I'm going to show you a crazy case later. If you're putting in this many smooth PDO threads on a patient, you are anesthetizing them. It's going to take an hour, hour and a half, 2 hours. What are you charging them? A lot of money for this. For collagen production, we'll use a quarter of the number of threads to get the same collagen production because, again, PDO threads are not all the same. I don't know why people think this, just like toxins are not all the same and fillers are not all the same. There's a different quality of PDO threads. And again, let me just show you, I want to get to the case that we're going to show you here. This is not AFI, not V-Soft Lift, showed you this before. If you need this many, you're using the wrong thread. And the other side, that's being planned out for that. And there's no chance you need this many threads for this. And again, here's Mint PDO. They literally, not this one, but they send this out once or twice a week. Their designs for this. I mean, why in the world do you need this many PDO threads? And again, they get a nice result, but with so many threads, that's a lot for a patient here. Our cases are mostly with AFI techniques and V-Soft Lift, 3 to 4 to 5, 6 threads sometimes, but on the heavier cases, but not anything like this kind of crazy threads. And these are, by the way, from Nova Threads and Mint Trainers, a mix. Again, I'm not exactly sure which is which, but they pretty much look exactly the same. And again, they'll tell you on the webinars that, you're going to need a lot of threads, and you got to charge the patient for this, for that. Well, not if you're using the right techniques. I'll let you decide. I mean, they get a nice result. I mean, but for the same result, would you want 20 threads? Would you want 4 threads? So let's go ahead and show you a case here, our first case. And now with that kind of a background, you really understand this a little bit more. Here we go. I want to show you a great case of solid filler lifting PDO threads. Take a look how her jawline is not straight. Everything is starting to sag as she gets older. So let's go ahead. We've got her mapped out, cleaned up really well, mapped out using ComfortTox syringes loaded with lidocaine 2%. And that's going to keep her nice and numb at the actual point where we start and towards the end of that thread here. We just like to go for the ultimate in comfort here and let that go ahead and take effect just a little bit. We are now marking where the area is, her facial artery. We want to be careful and stay away from that point, even though we are going to be superior to that. But you always want to know where your anatomy is at every single time. That is what is super important. Now we are using an 18 gauge pilot hole needle, and we are feeling for our landmark. We want to know exactly where we are. We're going to be around the zygoma, right on top of it, and we are going to place this now. This is important. Everything is going to be about the right plane. And here we are placing pilot hole needle. We're going to use a 19 gauge thread. So an 18 gauge pilot hole needle, just going to move it side to side, open it up just a little bit, as you can see. But this is first putting us in that right plane. So that's exactly what is going to happen. Now we are going to use AFI exclusive technique, a ComfortTox microcannula, and we're going to get her numb along the track. But what we're really doing here is we are doing something called pre-tunneling. And this pre-tunneling, again, is going to put us exactly in the right plane. Now, I want you to watch how we manipulate this microcannula different than everybody else. We never force it through. You see so many microcannulas that get forced through the tissue and just is ripping the tissue. It's supposed to be a non-traumatic or very atraumatic here, and that's the way it is. And it is with our techniques here. If we go ahead and we find that sometimes you've got to push through the ligament just a little bit, but reposition, and all of a sudden you will find yourself going through the areas nice and comfortably. And now we are in the right plane, and that's going to be the same plane that our thread's going to go in. And now we are going to deliver some lidocaine 2% along that track. Not much, very little as we pull this out, just to give the patient lots of comfort here. And so that is one tunnel for the one thread, and now we are going to go ahead and pre-tunnel this for the second thread. And same kind of a thing. And what you use what we call the curtain over the curtain rod technique to go ahead and pull the tissue over the microcannula and not shove the microcannula through. This is the way to use it. Now here's the trick. You've got to use the right microcannula, and only the ComfortDocs microcannula is stiff enough and has the right flexibility that won't dive on you, which is why so many of you hate it. So now we've pre-tunneled, we've delivered lidocaine 2%, not much. We don't want too much liquid in there because we want our PDO lifting thread to be able to really engage here. Now let's take a look. She's now ready for the lifting, the PDO lifting thread. So we are going to place this. We're only using 2 threads. Why is that? So many other companies will use 4 to 6 to 8 to 10 threads for the same case, because we are using V-Soft Lift. These are the best lifting PDO threads on the market here, and the strongest by far, and produce the most collagen. So what are we doing? We're going along that same track that we made with the ComfortDocs microcannula. Look how simple that is. Curtain over the curtain rod. We always know where the tip of our instrument is. Now we're going to exaggerate that tissue and come straight out. Look how quick and easy that happened to place the actual thread here with just a little preparation and comfortably. Yeah, you've seen the patient has not stopped talking throughout this entire procedure and has been talking to the injector. Now we're going to go down another thread, and these angles you'll learn in the AFE certification training exactly the vectors that work the best, and the PDO thread that works the best, and that's the V-Soft Lift. It's about 25% stronger than any other PDO thread on the market. So again, we're going to place it in the right plane, and we are going to use our other hand, curtain over the curtain rod. We're not shoving it in, we're pulling the tissue over it, and we're feeling exactly where we want it. And now once we get to place, we are going to go ahead and really start to make sure that we are perfect. Exaggerate the tissue, pull it out, and you are going to hear a click, click, click. You're going to feel it with your hands as all of the PDO thread cogs and barbs go to place and really lift up that tissue. Look how beautiful that is. That didn't take very long to accomplish there. And again, the strength of the V-Soft Lift are unparalleled. And again, put it up against any other company that's out there, and you'll see them using 3 to 4 times the number of threads for this exact same case. And here we're going to now go ahead, prepare a jawline thread, gave a little bit of ComfortDocs needle with a lidocaine 2% just at the entry and the end point there, so she's nice and comfortable here. And now we're going to go ahead and repeat that procedure right now. And this comes with, the reason you can do it fast is you've got to get some great certification training with the AFE, and these are AFE techniques for sure to go ahead and accomplish this. Now, ComfortDocs microcannula, these are fairly easy in this plane, and you'll see that is going to go straight to place there. We're going to go ahead and pull back on that and deliver some lidocaine 2% there. And now we are just going to be really just ready to go for all of this. Make sure your PDO threads are also FDA cleared class 2. That is so important. There are only 3 companies on the U.S. market that have the proper packaging and are FDA cleared class 2, and V-Soft Lift is one of them. Now, same thing. We're in that right plane. We are going to use our non-dominant hand, and we're going to go ahead and pull that tissue over the PDO thread. Curtain over the curtain rod is really the best way to explain it. Look how quick and easy that goes to place. That doesn't take long. Exaggerate the tissue, pull it out, and you are going to have a dynamite lift with 3 threads. I can't make that point enough, because you can go ahead and watch other trainers, and you can watch them use other threads, and there are so many more threads. Well, why do you need more threads? Because they're using fairly weak threads. And again, make sure they're legal threads to boot here. Now, let's take a look side by side. Look at the area, her left side, that is hanging down, and look at that beautiful jawline lift and that 2-vector lift as it pulls up and pulls back. That is an incredible side by side that you just saw happen You just saw it happen right in front of your eyes, and it's really amazing. And we get excited. We love these cases. We get super excited because it's immediate visible result that gets better over time. Now clip those threads, go ahead and clean them up, put some band-aids on there. They do get post-op instructions, which are important there as well. And make sure that you learn how to deliver this for your patients properly with the FDA cleared class 2 threads to protect your license and your patients. And now side by side, we've done neurotoxin, we've done fillers, we've done lifting PDO threads, we've done solid fillers, smooth PDO threads for collagen production. This is a great comprehensive case that all of you can learn how to do, and it's about getting great certification training, especially with the AFE. We will show you the best techniques out there, so it's time for you to get AFE certification trained today. And here you can see her before and after. And let's hang on one second. Here we go. All right, here you see her before and after, and that's all good. Now, it's not just PDO threads. It is botulinum toxin, bring those masseters in and do a few other things there as well. But you can certainly see that. It's fillers to pop her cheeks out, but she was already jowling already, and she's in her close to 40, early 40s there. That makes a big difference. She doesn't want to get old, right? I mean, no, I don't think anybody wants to get old like that. All right, Lori, let's show you a second case here too. But to answer some of your questions, because I'm sure a number of you, we mentioned this microcannula, ComfortDocs microcannula. You can get it at statdds.com. Best on the market because most microcannulas are way too flexible, and this is definitely stiffer. You know the problem with microcannulas that many of you have used or tried and you hated is you can't control them. You have to know where the tip of your instrument is at all times, and if it dives on you and it doesn't maintain the right plane, it doesn't help you. Pre-tunneling, the AFE technique of pre-tunneling is fantastic. I mean, it's just amazing how it makes the rest of the procedure go so much easier. But these are the best microcannulas for filler delivery or anything else. You can get them at statdds.com, and they're about 25% less than all the others that are out there. So this is the only thing we use in AFE training for that, and that's why it went through so easily there. If you want, there are two ways to get AFE live patient PDO certification training. One is through the AFE, and that's afetraining.com, or there's the AFE's phone number and email. It's 14 CMEs, full post-course support. We have full-time faculty just around to help you, plus all of the AFE forums there as well. But also, just so you're aware of it, you can contact vSoft Lift, and especially go to vsoftlift.us//training there, or email jacob@vsoftlift.us, because they have training packages available. We train our CME course. We don't mention vSoft Lift. You can use our techniques with others there as well. Of course, like I mentioned, the others you may need a lot more threads to do it, but the same techniques will apply. They're the best techniques that are out there to get the best results, like this one right here, which is lifting PDO threads, as you can see. But I mean, they have training packages available. If you buy enough product, you can get on-demand training. You can get you can come to an AFE live patient course. I think they give you some kind of a voucher, or if you buy enough, and they have the lowest, I think it's like $4,000 worth of threads. You'll get your own in-office private training, the same AFE training, same CME, say everything else for that. So they made it very easy. The training is basically free because they're basically selling you product, and that's on them to go ahead and get with us there. So really, it's really amazing the opportunities that you have. But I want to make that available because some of you are ready to go, want to buy product, or you've been trained somewhere else, and you want to go ahead and do that. So that might be really the best way to go ahead and do that for you, or come through the AFE. Either way works for us. You're going to get AFE CME live patient training either way. So let's go ahead and now I want to show you another case here real quickly. And this is just a different kind of a chart. And what this is looking at is vSoft Lift, lifting PDO barbed thread strength and or collagen production. I mean, 5 stars comparatively to anything else that is out there. And the cost per procedure, that's significant. Because you're using so many less threads, your cost is less. Your patient's cost can be the same, or you can charge them less for that as well. And that is really significant, really significant. You know, some of them may undercharge you per thread, but you've got to use 4 to 5 times the numbers of threads. I mean, those cases, and we're going to go through patient fees there as well, but those cases that were 20 threads on one side, 40 lifting PDO threads, and their lifting PDO threads are $50, $60, $70. I mean, you're into the cost of the procedure, okay, by a few $1,000s. That, and then what are you going to charge the patient? $10,000? And it's so invasive. I mean, again, these are things that you know, they'll teach you, or we'll teach you, hopefully a much better way to do this as a minimally invasive procedure that patients really will love. But let me show you our next patient. Let's go to our next patient here and show you that. And that's this patient right here. She actually is a nurse practitioner. She actually works in a med spa and is a great injector because she's been AFE trained, one of our great AFE members here. But she decided, you know what? She needs a little bit of help here too. Now, she'll get some botulinum toxin. She'll get some dermal fillers. Neither one is going to help with lifting sagging skin. So let me show you a part of her case, and I'm also going to show you some of her smooth thread case there as well. So it's everything together as we go through this. So here we go. Let's go with this solid filler lifting PDO thread case. And first, let's go ahead, clean the patient off, map them, give them a little bit of lidocaine 2% in a ComfortTox syringe right at the entry point where we are going to go ahead and do this. And you can see 2 vector lift up towards the cheek area and 1 vector in the jawline, pulling it back. And certainly we are going to do some neck work and a little bit of other treatment on this patient here. But here we go with an 18 gauge pilot hole needle, and we are going to go into the right plane. This is so critical right here, is knowing what plane to start in, because this will make the rest of the procedure go much earlier. This is why you need some live patient lifting PDO thread certification training with the AAFE, because this is the beginning of the entire procedure there, and you'll get a little bit of bleeding many times, and that will help you determine where that entry hole is, so you can easily go ahead and find it, because sometimes it can get a little tricky until you've had some experience with this. So now let's get in here. Now we are using a ComfortTox micro cannula with lidocaine 2% in the syringe, and we are going to pre-tunnel each one of these vectors here. And the reason for this is going to first of all make it much easier to place the lifting hole of the lifting PDO thread and in that hole and in that tunnel. And while we go ahead and retract, we are giving a retrograde injection of lidocaine 2%, and that is going to make this a lot better for the patient here. And as you can see, we're never forcing this ComfortTox microcannula. We are going very gently, and we are going to lift the skin many times over that microcannula, as you will go ahead and see, using our non-dominant hand to make sure we know where it is, make sure we're in the right plane, and that's going to be the subdermal plane right on the SMAS as we go down into that tunnel, and using the other hand and kind of push the curtain over the curtain rod very gently. Never force anything, and make sure that this is very, very controlled. Sometimes you may hit a little bit of a barrier, give a little bit of lidocaine, and so many times that will then you'll be able to pop right through there, and your life will be a lot easier here. But make sure you take your time with this, and you're never forcing anything. That is a critical piece of advice, because you see many times people are jamming things in here, and that is not going to work, and it can become much more dramatic than it really needs to be here. So you can see this is going just fine. We were able to pre-tunnel that, give some lidocaine on the way out, and that's going to make this procedure so much more comfortable for the patient. Now you're giving just a tiny bit of lidocaine, enough to get anesthesia. You don't want to flood the area, because this lifting thread that's going in now is going going to need to attach to that SMAS, and if there's too much fluid, then it will not be as effective here. We are using a V-Soft Lift lifting thread. These are the best, and that's the reason we only need 2 of them. These are the strongest by far. Now, as we go in, we're following that tunnel that we just created, using the other hand to go ahead and lift everything over the PDO thread, and then as we come out, we're going to really exaggerate that, as you can see, and really pick that up. And you can see the effect literally immediately here. Now we're going into the second vector. That's all it takes. Compare this. This is a minimum amount of threads because we're using the strongest V-Soft Lift threads and getting the maximum result, as you are going to see. Go ahead and follow that tunnel. Use your non-dominant hand, curtain over the curtain rod, and you can see that's going to go to place very nicely. Patient is very comfortable, and she's a nurse practitioner. By the way, exaggerate that lift as you pull everything out, and there you have it. 2 lifting PDO threads, and look at that lift, and you'll be able to see before and afters a little bit later on, and that is all you need. Compare that to all these other threads where you would need 5 to 10 in that area to match the 2 of these V-Soft Lift threads, and you can see some of their cases for yourself. Now let's go ahead and do this jawline lift, and she was numb from before. Now ComfortDocs microcannula, going to tunnel, pre-tunnel this. As you can see, go ahead and we'll use 1. That's all we're going to use in this case, but now we're just going to pre-tunnel this, give some lidocaine on the way out so the patient is nice and comfortable here, and you can see she's even comfortable with that. And why ComfortDocs microcannula? Best microcannula on the market for sure. It is not too flexible, and it really goes to place exactly where we want it. Now the thread goes in very easily, always knowing where it is, making sure we're in the right plane, and using your other hand to kind of push the tissue over this. As you can see, get it to place. Now exaggerate that lift, pull it straight out, and you can see a gorgeous lift right there. And that's the way you have 3 threads to accomplish this, and that's the way to do it. And this smoothing is as important as part of the procedure as anything else, because we want to make sure that everything is really engaged. There's no dimpling of the skin or anything else like that. Now would be the time that you could work any of that out if you needed to. And so we're really stretching that skin and make sure we are getting the best lift possible on this patient. And she is going to be very, very pleased with the result here once we are done. Now it's time to trim these off, and we are going to grab them, pull them tight against the skin. Sorry you can't see this, hard to see, but we're going to pull them up and tight, go right against the skin, and make sure you clip these. That goes very quickly, and you want to go ahead then and pull the skin over those entry points so that that will go ahead and hide all of these threads here. So you can see she may be a little black and blue once we are done, and that would be perfectly acceptable for this, but this is not going to give her much to any problem afterwards here, and anything that may be a little bruised can be hidden with makeup, so the patient will be very pleased. But take a look at the result. Look how tight that jawline is. Look at that snatch jawline. Look at that lift as with the cheek popping out, and that is looking absolutely fantastic. Make sure the area is clean and put band-aids on, and now the patient is ready to go and heal up here. Here is an amazing before and after on this patient here, as you can go ahead and see. Before, after, this is with 2 vector lift in the cheek area, 1 in the jawline pulling it back, and then also 3 in the neck of lifting threads, and then lots of smooth PDO threads, as you saw, in the neck and in the chin, and that is going to produce this kind of result. Now, here she is a few months later, and you can see that jowl has really picked up better than ever. Everything is nice and tight. She can certainly have botulinum toxin, dermal fillers to fill in other areas and get treated at the same time. But look at what you can accomplish with lifting PDO threads, smooth PDO threads, and AFE techniques. So it's time for you to learn this and add this to your practice. Time for you to get AFE certification trained today. All right, here she is right after this. Hang on one second. Let me get this to work correctly. Here she is right afterwards. Well, not right afterwards. Here she is healed up from the lifting PDO threads. But now what we want to show you some of the smooth PDO threads, because that's when you really get some of the collagen biostimulation. Now, this is a great start to her transformation. Her transformation is going to involve, like I said, lifting PDO threads, smooth PDO threads, fillers, botulinum toxin, and so let's introduce you to that. So we're going to show you her smooth PDO threads. We're going to talk about patient fees, and then we'll start to show you some before and afters to make this nice and tight for you, so you can really see what is going on here. So let's go ahead and show you this V-Soft Lift PDO threads here, the smooth PDO threads. Now, what's different about these than all of the others? What's really different about these is they have a special polymer coating that is going to be much different than anything else in terms of they slowly break down. They more slowly break down. What that means is more collagen biostimulation, and that is why you need so many fewer smooth PDO threads for V-Soft Lift than you need some of the other ones, because this is going to be pure collagen biostimulation. We're going to go back to that patient and see exactly that. And take a look. If you're doing this, if you literally are using this many threads, I got to tell you, this just gets crazier and crazier. And people proudly post this on social media. If you're using this many PDO threads, you're using the wrong threads. I would tell you, with this many sticks of a needle, you don't even need the PDO thread to get collagen production. The body will just give you enough collagen just healing itself through this. This is, I hope most of you, in my opinion at least, absolutely insane. I mean, really, it's absolutely insane when it comes to going ahead and dealing with this here, because this doesn't make any sense at all for this. So and this one, there's just no words for this next one. Just no words for this. This, by the way, the practitioner that did this said this took 2.5 hours. This patient was like sedated, had full face anesthesia to go ahead and do this. There is not a scenario in my world that you would really even need this here. I mean, it doesn't make any sense at all for this here. All right, so let's go ahead and show you this here. This is the AFE difference right here. I mean that last case was really crazy. Here's the AFE difference head to head by what others show. I mean, again, you guys make the determination here. Do you want that many Nova threads? Do you want that many V-Soft Lift for under the chin? Under the chin, by the way, and neck is some of the best areas to go ahead and treat, because, and I'm going to throw out a concept to you that you will surprise a lot of you. Under the chin, that will skin tightening, collagen biostimulation, and permanently remove fat. Does that sound like another product, an acid, deoxycholic acid, that you go ahead and inject down there? Through the mechanical action of those threads going in, you will permanently remove fat, but you also get collagen reduction. You also get skin tightening. We're going to show you on that same patient from before how to go ahead and do a little bit of neck tightening here with smooth PDO threads. Then we'll show you her complete before and after. So here we go. Here is a great use of solid filler smooth PDO threads in the neck, and for necklace lines, and for tightening that neck and chin and permanently removing the fat underneath the chin here. But let's start with this. Smooth PDO threads. What happens? Polydioxanone threads is a suture material that is absorbable, slowly absorbable, and over time it goes ahead and starts to dissolve. And it takes about 3 to 4 weeks for that process to really start to go. And the body's natural reaction from an aesthetic point of view is to build collagen around it as it is being absorbed here. So as you can see, we've mapped out this patient, and the ones on the side are for the horizontal lines. These are for the horizontal lines, but this right underneath the chin, this is also going to permanently remove chin fat as it goes through that fat pad in there, and then the body will build collagen to tighten all of the skin. So really you get a dual action in doing this. Now, why do they go in so easily? Because you've got to be trained. Once you know the right plane for smooth PDO threads, it is so easy to place these into place here. Now, the neck has got some very thin skin. Now, we've also on her, if you take a look, see some Band-Aids, and we just did a 2-vector lift in her face and a 1-vector lift jawline and 3 vectors in the neck. So now we're also, same appointment, placing smooth PDO threads in this area. And this is going to go ahead and build that collagen, tighten everything while it's been pulled tight already with the lifting PDO threads. So you can have a lot of combo treatment in one appointment, which is amazing for this. Now, V-Self Lift, these are the smooth PDO threads we are using. Why? They are the best. They are the best collagen producers. They have got a special polymer coating on their PDO threads, which means that they take a little longer to break down. And the longer it takes for them to break down, the more collagen the body produces here. And also, it's a minimum amount of threads. Now, this may look like a little bit more than usual because it's a very long and wide area that we're doing. We're doing a lot in this area, so you're seeing a lot of threads. If this was any other competing thread, you would need 4 times as many smooth PDO threads. Certainly you've seen some of those crazy pictures, but this goes in just a few minutes if you know the right plane and have been properly trained. So you can see we've treated all these areas very simply. This is going to tighten and lift. We're doing this all in one appointment. Now, 360 turn, there's a little loop on the end of these syringes of the thread as it comes out, and that gets attaches in the tissue once we go 360, and it's very simple to go ahead and pull them all out. So we do this in combination with her lifting threads and patients lifting threads all the time, and that combination is a lot of collagen biostimulation, a lot of lifting from the lifting threads action, and that is very effective treatment, and you'll be amazed at the before and afters on this patient here. And it's about getting trained. Live patient certification training is essential to know the right planes. That's what makes it go in easy and get the best aesthetic outcomes for every single patient. So get trained today. Here is an amazing before and after on this patient here, as you can go ahead and see. Before, after, this is with 2-vector lift in the cheek area, 1 in the jawline pulling it back, and then also 3 in the neck of lifting threads, and then lots of smooth PDO threads, as you saw, in the neck and in the chin, and that is going to produce this kind of result. Now, here she is a few months later, and you can see that jowl has really picked up better than ever. Everything is nice and tight. She can certainly have botulinum toxin, dermal fillers to fill in other areas and get treated at the same time. But look at what you can accomplish with lifting PDO threads, smooth PDO threads, and AFE techniques. So it's time for you to learn this and add this to your practice. Time for you to get AFE certification trained today.
Let's go ahead and show you her before. I mean, again, this is a transformation over time, but you can see amazing transformation on this patient here, certainly from the front there as well. Could you do this with a facelift? You could. Hang on. You can't do this with a facelift because a facelift does not add volume. So it's different. And by the way, we do a ton of PDO threads on patients after facelifts. But lifting PDO threads can last anywhere from 1 to 2 years. Many patients, they last longer than that. Occasionally, they come back again with the AFE techniques and V-Soft lift. They may come back for a maintenance thread, maybe a year in, or it's really just depending on their needs because they continue to age for all of that. We do a ton of PDO threads after people have had facelifts. Why? They want a little extra lift in this one area. Collagen biostimulation, you don't get that with a facelift, right? I mean, if anything, it pulls it tight and there's a lack of volume, and that's why many of these patients look so skeletal. So you give them fillers or you get them collagen biostimulation. It's not a replacement. We all work together. That's the amazing thing. There are a lot of patients, though, that, I would have thought, you need a facelift. And they say, let's try it minimally invasively first, and not a problem. We can definitely try it minimally invasively first. I mean, this next patient is going to be one of those patients there for sure. I mean, that is really a 3-vector lift. She had 5 on each side of her face, nothing else. She did not have fillers yet at this point, did not have toxin yet at this point. One of these, they were just literally before and after, just with lifting threads. That's amazing. I mean, that is really amazing. And I think really 5 on each side as opposed to 20 on each side. And again, I'm just telling you exactly what the other manufacturers of PDO threads, the other trainers, what they teach. They post it all the time, so you can. It's all public, and you can all go ahead and see it. But we are very much in the AFE all about maximum effect with minimal amount of threads. I'm not here to sell threads. I'm here to do what is best for the patient, get the best result with the fewest amount of PDO threads. And when you're properly trained and you're using the right PDO thread, these are the kinds of results that you're going to get with all this. But again, it's not, when it comes to total facial aesthetics, it is about a patient like this. You lift them up first, and that's the order, the sequence usually, is you lift them first, then go back with fillers and botulinum toxin. Many times you can do the toxin, the neurotoxin, the same day as the PDO threads or before. It really doesn't matter. Absolutely want to give them, and listen carefully, those of you who do threads. And I'll tell you this, I mean, we are all about total facial aesthetics in the AFE #1, but they all work synergistically. The reason that we will always give a patient masseter botulinum toxin, neurotoxin, when they've had PDO threads. Why? Because it reduces the intensity of contraction of the masseter, puts less stress on the thread there. It can keep lifting a lot stronger. They all work together. And again, you'll learn this in AFE training. So much to do. But literally, this is the same patient. A lot of people they tell me this can't be the same patient, but it is. And we love the selfie in the car, while they're picking up their kids with the natural sunlight. We do not do the hair. She does the hair, but definitely we did the Botox fillers, PDO threads, smooth and lifting, because smooth by itself are an amazing, amazing thing. That I think smooth, if you're ready to do Botox and fillers, you absolutely should be adding smooth to your at least to start, because I'll show you an easy way to do that, because they are amazing for what you can do with that. Let's go ahead and show you. Now, let's talk about patient fees and how we do this. Now, again, this only applies to VSoft lift, because if we're doing a 3-vector lift on each side, look at this before and after. That is amazing. So 3-vector lift, only VSoft. If it was any other company, it would be a lot more. So you're going to have to charge a lot more. 6 VSoft lifting PDO threads. Your cost about $210. Patient fee anywhere from $1,400 to $2,500. A wide range. That's up to you to determine there. And remember, and I hope you'll take this to heart, but it's for sure. And thankfully, PDO threads, one of the only things that have not been commoditized yet in injectables, and hopefully it will not be, and we need to get away from that in general, even with toxin and fillers, the commoditization of this. But here they're paying for the results. It doesn't matter if I use 6 PDO threads or 25 PDO threads. The difference is when you need 20, 30, 40 PDO threads to get this kind of lift, you've got to charge the patient $5,000, $6,000, $7,000. Why? You can do it a lot more affordably for your cost, a lot less complications when you're using less threads. I mean, just about everything else. This is a 20-minute procedure once you get some experience for this. Results last 12 to 24 months. And even if I quoted a patient $2,500, $2,000, if I had to throw in an extra couple of threads, because I can see at the time I'm doing it, that, you know what, I'd really like one more thread. I mean, it doesn't cost me anything. I mean, literally, it does cost me, whatever, $50 or whatever it cost me for the thread, but it's not going to really affect the profitability of this procedure for that. Snatch jawline, and this patient obviously didn't pay, but she makes a great model because that's my wife. But snatching back that jawline for that, 4 VSoft lifting PDO threads, 2 on each side. Patient fee, if you're just doing snatch jawline, can be easily $1,000 plus 15. It's literally a 15-minute procedure once you get well trained and get some experience for that. I mean, the ROI of this far surpasses with the amount of time Botox and dermal fillers at this point in time. Again, because we've so commoditized everything together. Most of the cases we do in the AFI training centers, in our faculty, in their own aesthetic practices, med spas, dental practices, are combination cases. Here's a smooth thread case. This is a real paying patient for this. 20 on each side, not 30, not 40, not 50 on each side, 20 on each side. I'm sorry, 10 on each side, 20 total. Your cost is $100, and we do this about $750, so that's a range for you. This treatment literally takes 5 minutes, and it's usually about 3 treatments to get this kind of cheek enhancement with no fillers. This is only collagen biostimulation. It takes time. It takes 2 to 3 months to really get this going, and typically that patient fee is per treatment. So she's paying $750 times 3 if it's 3 treatments. Some people get enough in 2 treatments. Some people need a little bit more. Some people are good with 1 treatment. So it just really depends on them, their lifestyle, their collagen biostimulation, all of those kinds of things there as well. So, I mean, there is nothing like, at the very least, right now, you should immediately learn Smooth PDO threads. We'll tell you how, because the AFI can do it virtually. But lifting PDO threads, absolutely. If you've been doing Botox and fillers for any amount of time, there is no way to get total facial aesthetics without lifting and smooth PDO threads. So I will take questions in just a Follow the AFI on Instagram, Facebook, YouTube, and TikTok. I'm going to take questions in just a minute. Here are the 2 ways. If you just want PDO thread training, the 2 ways to do this. You can either go straight through the AFI, and you can call, email, go to afitraining.com and go there. This is a 14 CME. No matter how you get trained, this is a 14 CME course, live patient training course, post-course support, or vSoftLift does have. Go to vSoftLift.us/training and take a look at the packages. I mean, they've got different packages that will give you different levels of training, but the highest package, again, I think, don't take my word for it, go there. I think it's only like $4,000. If you buy $4,000 worth of product, you will get a live patient training in office, a private training in your office. So check there. Don't take my word for it. Check there for all of that. And that's for a limited time. So if you want it, you better grab it. Or there's probably an in-between package where they'll give you a voucher to go to an AFI live patient PDO thread training for that. So those are the 2 different ways you can get training on PDO threads. And here is all of our training in the AAFE, and we welcome you to any of our live patient CME certification training that we have got, whether it's level 1 foundational Botox and fillers, level 2 advanced, level 3 master courses. We've got master lips, eyes, and nose for those of you who are advanced, but lifting PDO threads, you've got to add them to your practice, as we've talked about, and smooth PDO threads. They are so fantastic. So we've got live patient training, smooth PDO threads, we've got virtual training there as well, and so much more. Cadaver lab and ultrasound training, so much the AFE has to offer. So we really hope to see you at an upcoming training real soon. And again, here's my information. If you have any questions about this afterwards, Dr. Lewis at facialaesthetics.org and the AFE's info at facialaesthetics.org. And then here again is just a great resource slide, afitraining.com, for the best tuition specials. So make sure you go there and check that out for AFE training. AFE Virtual is the only live virtual CME certification training, 8 CME on smooth PDO threads. So definitely take advantage of that with tuition specials going on. AFE Ultrasound, AFE Cadaver Lab, the best cadaver lab because it is very intimate. We keep them small so that you have the ultimate experience for injecting and dissecting, really understanding the layers, and it includes ultrasound training, the only course of its kind. StatDDS.com, all the Comfort Talks line is sold through them and a lot more. vSoftLift, and certainly we've
It's the one we prefer because maximum effect for minimum amount of threads, and that is really what is best for your patient. WaveAesthetics.com, the best ultrasound, and certainly keep a look at afewebinars.com because we are always having online trainings that we hope you will be a part of. So thank you so much for being a part of this. We're here for you to help you be successful. So continue to success to all of you. We will talk to you all again real soon.